Well, here we go again.
This is the Northamptonshire Carers Podcast.
And a warm welcome to the November Northamptonshire Carers Podcast. And this and the December one are going to be hot on the heels of one another because we're going to release the December episode probably about the 10th or the 12th of the month. This time around, a couple of conversations with colleagues from Northamptonshire Carers. Jackie Lloyd-Jones will be talking about the dementia groups that she is a key part of and telling you all about those and what they offer. And after that, a conversation with Keri Platt talking about the Breathing Space project and also support for people who are experiencing long COVID. And we'll end this podcast episode in a way that will hopefully lead you to feel calm and relaxed, as Keri's kindly shared with us one of her guided meditations. So that's the thing that we'll end up with. Jackie Lloyd-Jones is with me. Hi, Jackie.
Hi, Adam.
And you're a dementia care advisor and group facilitator as part of the Age Well project. Age Well or Aging Well? I always get that wrong.
Age Well.
Age
yeah,
Well.
yeah.
And I wondered if you'd talk to us about the dementia groups that you run for us.
Nearly 2 years ago, we set up the Dementia Activity and Information Groups. They're a place for people to come and to meet people in a similar situation, people who have dementia and their carers. We meet there, we have a cup of tea, we have a biscuit, we have a bit of fruit every now and then. And it's a place where people can come and feel totally safe. It's a place where they can make friends and get peer support. And that's a massive thing. It's talking to other people that are going through things that you're going through.
Yeah, I think that's absolutely right, because otherwise you can feel like it's just you that's going through it. Being able to check in with other people, I'm guessing, is quite a big part of the group.
Yeah, it's a massive part, and following the pandemic and the isolation, it highlights it more than ever about the importance of chatting and making friends and doing things with other people. And sometimes it becomes all consuming. You get the diagnosis of dementia and you just sit at home thinking, what do we do now? Where do we go? What do we do? How do we deal with this? And so at the groups, I run the groups, and I can be there and I give dementia advice and support to people. They can ask me about anything, and they do. It gets a bit funny sometimes. And I also have another member of staff with me at every group, and two of our amazing volunteers who give their time for free, and they get lots of information at the groups, obviously paper information that we give out, and the support, which is vital.
Yeah, absolutely. And just sort of thinking about where the groups take place. So is it one location or various locations across the county?
We've now got four. We've got one in Rushden, and we've got one in Northampton, in the centre of Northampton, and we've got one in Moulton and one in Wellingborough. And we're hoping to open some up in the West Northants within the next few months, sort of Daventry Toaster area. Yeah, and then hopefully probably in the north as well, Corby area. That's going to be in time,
It sounds like it's quite an informal atmosphere.
Absolutely, and that's the whole point. It's to come. If you're late, it doesn't matter. If you need to leave early, it doesn't matter. You can just drop in. Most people come for the whole time, and they're making real good friends. They're exchanging phone numbers. They're meeting for coffee, and when they go out, often it's married couples that come. Sometimes it's children with their parent or parents with their children that have dementia. They come along and they make friends, they go out for coffee. And when they go out in a four, it gives them the confidence to go out and not feel that people are looking at me, or those horrible things that you can feel. So, it's very beneficial, to people's mental health and mental well-being.
I think it's interesting that you mentioned the impact, if you like, of the experience of the worst of the COVID pandemic through 2020 and the first bit of 2021, that it did, because we had to really, because it was the sort of requirement at the time. It did lead people to feel much more isolated. Probably as a carer, you can feel that anyway quite often, but certainly people with particular health issues, that anxiety would be raised. So I guess that maybe having a group is gentle encouragement for people to come out to, as you say, a safe space.
Yeah, absolutely. And it is very safe, you know, and they never need to worry about what happens there. And when they start, I usually give them, I call it a little starter pack. It's not loads of information, but it's information to help them in their caring role.
Mm-hmm.
And also I've put together a checklist to make sure they're getting everything that they're entitled to, benefit-wise, but also to help them live well with dementia.
Yeah.
You know, and we go through this, and it can be really overwhelming to begin with for carers. You know, for everybody, when you suddenly get loads of paper to look at and read. But I guide them through this, and it can sometimes take 2 or 3 months, and that's fine. It doesn't matter. So we talk about avoiding crisis, because if something happens and, you know, suddenly you have to call an ambulance or something, or in the middle of the night, the last thing you need to do is rushing around the house finding things and putting things into place. So we guide them through the process of attempting to shut the door before the horse bolts.
Yeah.
You know, make sure they've got everything to make their life as easy as possible. So I make sure they're getting the attendance allowance they're entitled to, their council tax reduction. Because of the diagnosis of dementia, you're entitled to 25% off your council tax, and 100% if you live alone with dementia. Right. We have specialists come in to discuss powers of attorney. There's 2 sections to it. There's the health side of it, and there's also the financial side, and they need to get that in place as soon as possible. And it's better to do that while the person has full capacity and they make their own decisions about things. We talk about wills and trusts, and make sure they get the blue badge they're entitled to, and lifelines and radar keys and key safes and all of these things. And then it's amazing that people say to me, "Oh, what a relief. All that's done now, I can shove it in the cupboard or in the drawer, and I don't feel that panic now when something happens. We're good to go."
I guess from what you're saying, Jackie, that some of it is about living in the here and now, in the moment, and recognising some of the good things, but it's also about planning a bit ahead for the future, so that actually makes things a little bit more copable with when they do change.
Absolutely. And if you've done all of that and you've ticked all the boxes, you can then fully live in the here and now, and live day by day and enjoy every day.
I know that on a previous podcast, Pete Middleton spoke about, as he put it, living well with dementia, recognising the challenges, but actually looking at the fact that you can live a good life as much as is possible, really.
Absolutely, you really can, and you can, you know, you can put all these things in to help you with that, and talking about it is the biggest thing. You know, it's not the taboo it used to be years ago, and we can talk about it and have that understanding. And then when you understand how to live with it, everything in your life is easier, much easier.
Yeah. I guess as well that some of it too, and you kind of referred to this, is that it's a combination of peer support and maybe sharing ideas that people might have encountered something specific that occurs for the person that they're supporting.
Yeah, and that happens all the time at the groups. You know, people will be chatting, "Oh, I can't cope with this, I don't know how to do that," and somebody will pipe up, "Oh, I've done that, just, you know, try this or try that, or ring these people." I'm learning, we're all learning every day, you know, and the peer support is massive, and I can't say, the support that people offer each other is second to none. And the volunteers, most volunteers, not all my volunteers, are ex-carers.
So they've got that lived experience.
They've lived it, and you know, their experience and their life skills, you know, and the support, the empathy that they can bring to the group is fantastic, and the carers really appreciate that.
And I'm thinking too that it can sometimes feel, when you've been a carer and maybe you've had to jettison lots of things that might have been part of your life before you became a carer, it can sometimes lead you to sort of feel a little bit sort of on the margins of things. So it sounds like that there's that potential for a real sense of value in that lived experience from volunteers coming in, having been there, and obviously for the folks that are coming along to benefit from that, and that kind of sense of being able to empathise from experience.
Yeah, absolutely. And I love the feedback I get from the volunteers. You know, they say, "Oh, I get this lovely warm glow when I leave the groups," you know, and it stays with me all day. It's so rewarding for them, and it gives them a sense of purpose. And yeah, they absolutely love it. And you know, they say it's so special. I'm doing this for nothing. I'm not getting paid. I'm doing it because I want to, and it's really rewarding for them.
And I think there is that thing about if you're volunteering your time, it's because you want to be there in that place doing what you're doing. And that does come across, I think, doesn't it, in interactions that people have.
Yeah, absolutely. And the way they support people, their empathy, you know, how caring they are and kind to people. It's quite humbling to be around some of our amazing volunteers. We couldn't survive without them, Adam. That's an absolute fact.
Yeah, no, they're crucial part of the organisation and what we do, and many things would not exist.
No, it's certainly
without volunteers and their experience and skills.
Yeah. So shall I talk about what we get up to at these groups?
Yeah, that would be brilliant.
So as I said, the main thing is it's a safe place. People come in, we all start with a cuppa, of course, you know, and a biscuit and a chat.
Always important.
Yeah, and I allow people that time at the beginning. And if we've got a guest speaker come in, it's always half an hour into the group before they start. We let people settle. Some people are late, and that's fine. You know, it's not always easy to get up and out in the morning. So we have regular activities. The tables are always set out very similar. We have jigsaws, we have painting, we have colouring, we have books, we have various different things on the tables every time. And then we have games, tiddlywinks, pick-up sticks, the games that are familiar from our childhood, and they're really great. So that's all going on the tables. Then I do quizzes, not every week. We regularly have music quizzes. They're really popular. And at each group, I make a playlist on my phone.
Brilliant.
And everybody puts in 2 or 3 of their favourite songs. So each group is different. Yeah. And when the music's playing, so if we're doing a craft activity, for example, or painting, we'll just sit there quietly painting away. And it's quite strange. I put the music on, so the room just then goes quite quiet and they get really absorbed in their activity. Yeah. It was pretty amazing at a group a couple of months ago. We were doing these beautiful cards, and they're watercolour cards, and this gentleman started painting, and he was an hour he spent on this card. It was a picture of an owl, and every fleck of feather he put into this. It was amazing. Yeah. And he's had dementia for a couple of years, and his wife said to him, "Well, I didn't know you could paint that well." And he said, "No, neither did I."
Yeah.
And he loved it. And he was going to give it to his granddaughter. He said, and he wrote in it that it was to his granddaughter. And his wife said, "Right, Jackie, where did you get these from? I need to get some, you know." And that's what they learn at the group. So she sort of left the group. She went straight over to the shop that I told her, and she bought it. And now every morning, if they're not going out, he'll sit and paint a card. And he loves it. And
yeah, that's really great to discover something new and something that is and something you can get so absorbed in.
Absolutely, yeah, that they can really get absorbed, and they feel a sense of purpose. They feel that, you know, we feel that we're good at something. Oh, I didn't know I could do that. Probably all of us have got something, you know, and through our working lives we never have time to do it. Then all of a sudden you've got time, and you think, oh. And this is what they can do at the groups. They learn the things that they can then do at home with their loved ones, you know, and keep each other busy. It's not about sitting watching the telly all day, and that's important. So yeah, we do that quite a bit, and then we have quizzes, say music quizzes. We have picture quizzes and various different things. And then we play golf indoor, and at our Rushton group, the lovely, we have it at the John White's Golf Club, and they allow us to go out on the putting green. And
that sounds good.
We have a bit of a giggle out there. We play bocce, which is similar to bowls. Quite a lot of games. They get very competitive, to say the least. Is great, and there's that sense of well-being, and the same thing every time when they come into the group. It's a similar set out, and then we're all learning then to concentrate on the positive mindset of what we can do, not what we can't do. Yeah. Let's not think, oh, they can't do that anymore. Let's think, yeah, we can do this, and we are doing this, which is brilliant. And then we also have a Targo fitness instructors come in to the
Oh,
group.
right.
They've not started at the Wellingborough group yet because it's relatively new, but they come to all the others. And these are specialist fitness trainers. It's all sit and keep fit. It's nothing drastic. They sit down for half an hour and we do some fitness. And you think, well, I've not really done much there. I've not moved. And then all of a sudden you actually think, yeah, I have. And we're getting a fantastic feedback. People are doing the exercises at home and their mobility is improving, which is fantastic. And then it's all about falls prevention. As we get older, we're more susceptible to falling.
Yeah.
And that's great.
Yeah.
And it's good fun. We do it to music and we have a laugh.
I'm just sort of thinking as well, the sort of benefits, as we know, of some sort of exercise to our own well-being. So people are getting that as well, aren't they, from both the group and if then in some cases sort of carrying it on at home.
Yeah, they do. And the fitness instructors are amazing. They really encourage people, just try this one little exercise, and it's very gentle. It's very, it's easy to do. You can sit and do them while you're watching the TV. And that's what we need people to do. And then slowly they're like, oh, okay, I'm feeling better. I can get up out of my chair a bit easier than I could a couple of months back, And that's helping, of course. We all need to work on this as we're getting older.
Yeah, yeah. And I guess as well that it's that thing too about seeing that it's made a difference. And that's kind of then a motivation to think, well, I'm going to carry on doing that because I can see that I can move around more easily or I feel better in myself for doing that.
Absolutely, yeah. And we always have a good laugh doing it. It's not serious. It's not meant to be. My groups are not serious places. It's a place where you come and you have fun. And we have a giggle and we feel good and we all support each other, you know, and that's really important. Yeah.
So how long do the groups tend to run for, Jackie?
Yeah, they're 2 hours.
Yeah.
So it's you turn up, we have a cup of tea, a biscuit and some fruit. And then if we've got a guest speaker, they'll start about half an hour into the group. We have speakers talking, about the legal stuff, the healthcare profession come, how to navigate around the health and social care. People come in and they talk about how to navigate your way through the care system. If the time comes, and it not necessarily does, they come. We have people from the fire service coming in. They do a free fire safety check on your home where they will put in free smoke detectors, carbon monoxide, and that you can get that all done for free.
Oh, brilliant.
They come we have people come from Deaf Connect to help with hearing. We have various speakers come in to talk about different services, Age UK and that. So and it's giving people the information to help them live well.
Yeah, so it sounds like it's a great combination of actually being with other people and sharing time and ideas. It's about having some fun. It's about learning new things and trying new things and getting information for the now and the future as well by the sound of it.
Absolutely, yeah.
So if people are listening and think, oh, that might be something that's for me, or I've got a friend or a neighbour or family member that might benefit from that, then how do they find out more and maybe get involved in one of the groups?
Okay, so the first thing they need to do is they can either ring our general inquiry line, and that's 01933 677 907. They can look on our website and they can email us and then raise their interest in a group. A couple of the groups have a waiting list, unfortunately, and then as soon as a place is available, I will contact them. And that's what the first thing they need to do. In the meantime, if they need any support, of course, they can ring our support line and get support that way. And a lot of people get quite daunted with coming to a group the first time, really scared of coming in that front door. They don't know what they're going to walk into. And it's fine. I've gone out into car parks and chatted with people. And as soon as I start chatting, it's fine. We'll have a cup of tea. There's nothing scary going on. And once they're in the door, that's it. They're fine. And especially if they come and we have singers come in a couple of times a year and we have dancing and we're jiving at 11 o'clock in the morning and generally having a good time. We have a person come in doing gardening, hanging baskets, things like that, different craft activities. and they see that it's what's going on, and they think, oh, okay, this looks like a fun place to be,
Yeah,
you know.
yeah.
And once they're in the door, of course they're going to be anxious the first couple of times, and then they settle in and they make friends, and all of a sudden they're like, oh, we're going today, you know. They think they'd love it to be every day, but you know, can't be.
And it sounds a good mix in the sense that it's clearly going to be focused around dementia, living well with dementia, planning for the future, etc., and support that might be available. But it also sounds like there's lots of things that are included as part of the groups that actually do something that doesn't always happen, which is recognizing that you are not totally defined by a diagnosis, that you have other interests and things that you enjoy and have enjoyed and continue to enjoy, and it's bringing those into the mix as well, isn't it?
Absolutely. And singing and dancing is fantastic for that. I mean, we all say, oh, no, I'm not going to dance. I don't want to get up. And then everybody gets up at the groups and they all dance and they all remember the moves from years ago. And I have carers and people with dementia saying to me, oh, Jackie, I can't believe you've got me doing this at 11 o'clock in the morning, you know, and I don't care. I don't care if anybody's watching me. And, and that's the lovely thing, you know, and it's great. It really is. I love doing the groups. And we don't talk about dementia all the time. And when I generally talk to people to one side, you know, I don't stand up and talk about it. People don't want to hear about it all the time, you know, they're living with it. I never forget one gentleman came to my group, lovely couple, and he said, as he left, he was very reluctant to come in. And then we had the group and it was lovely. And then when we left, he said to me, I've really enjoyed it here. He said to me, you've not mentioned my memory once. And I said, well, no, I don't need to. It's just about us having a bit of fun. He said, do you know what I thought this was going to be? He said, I thought this was going to be a load of our women banging on about my memory and talking to me about it. I said, no, it's the absolute opposite of that. It's a place to come and get peer support and have a bit of fun. Yeah, so it's that misconception about what people think is going to happen.
Exactly, yeah, and it must have been a breath of fresh air for him to experience actually what happened as opposed to what he got in his head that happened. And that might be a really useful thing as well for having explained all of the different elements of what happens in the group and that bit of feedback from somebody that attended. That might help to sort of be a bit of a myth buster in terms of what people might have in their head it's all going to be about. Just jumping back for a moment, so people can contact us on the 01933 677 907 number or via the support line. If people want to email, is there a specific email address that they should sort of send stuff to, or is it just sort of generally through?
Just the general email address, and then the administrators will direct it through to me.
Okay.
Because I'm not behind my computer all the time.
Yeah, you're out and about, aren't you? Yeah.
Out and about a lot, so that you can't rely on me getting that, you know, so at least they can then get a quicker response.
So that'd be carers at northamptonshire-carers.org, I think.
That's it, because we live in the longest named county in the country, I think, don't we? Or one of them.
One of them, yeah.
Yeah, but no, they absolutely can get through. And and then, as I say, we have got waiting lists, but they'll be very welcome to go on that. And hopefully, you know, as time moves forward, more groups are going to be opening. Yeah.
Excellent. So it's always evolving, isn't it, really?
Definitely, definitely.
Thank you so much. That's been really enlightening. And it's actually, given that I work for Northamptonshire Carers, I'm sure I did know some of this, but it's led me to sort of understand more, which is great because that means that I can then share that with other people as well.
That's wonderful. Brilliant. Thank you, Adam. Thank you very much.
You're listening to the Northamptonshire Carers Podcast.
And the final item on this November episode of the podcast is a conversation that I had with Keri Platt about our breathing space and long COVID support services. It's great to welcome Keri Platt to the Northamptonshire Carers podcast. Hi, Keri.
Hi, thank you for having me.
It's a pleasure. And you're a senior wellbeing practitioner for our breathing space project.
That's right.
And quite a straightforward way to start, really. I just wanted to check out what breathing space is, what it's all about, really.
Okay. Breathing Space is part of Northamptonshire Carers. We are also partly funded by the NHS. And historically, Breathing Space was set up to support people with COPD, which, for those that don't know, is chronic obstructive pulmonary disease, and then also other chronic respiratory diseases. And the idea was for a GP to be able to see a group of patients and to be able to give them slightly more intensive care in sort of the time frame of an hour rather than seeing them one-to-one. And so it's evolved to the groups that we have nowadays, which are based around that idea. So our groups are support and well-being groups, but we also have our GP present once a month at all of our groups. And in addition to the COPD groups and the chronic respiratory groups, we also have something called Singing for Lung Health, and then also groups for long COVID. So our service has really expanded.
I wonder if you'd tell us a bit more about the groups, some of the venues that they take place at in terms of location in the county.
Sure. So as I said, the groups are for people with COPD and other chronic respiratory diseases, or if it's the long COVID group for people with long COVID. All of our groups, we also welcome carers to come along as well. And we have quite a few groups now. We've really expanded. Altogether, Breathing Space has 9 groups. 7 of those are the COPD and chronic respiratory diseases groups. And then one of them is our long COVID and the other is Singing for Lung Health. And they really are based all around the county. We have our newest group is in Kettering. We have a group in Corby, Raunds, Wellingborough. We have Daventry, Moulton, Northampton. And then one of our long COVID groups is also online via Zoom.
Oh, right. So there's absolutely loads then,
Yes.
isn't there? So, and very accessible for people, whether it's going along or in some instances sort of doing stuff online.
Sure. Well, our COPD groups are all in person.
Yeah.
And we do make a point of ensuring that our venues are accessible. So there's parking, level access. We try and make sure that everybody's needs are covered and included. But yes, for our long COVID groups, quite a lot of our members are really, really unwell and can't actually get out. So we do have a lot of members attending the Zoom group as well.
And I know that if somebody's thinking about coming along to any group, I guess, that we might offer, there might be a sense of feeling that could be really useful to them, but they also might feel some degree of anxiety about that. I just wondered if you could say a little bit about what somebody might expect if they were coming along to a group.
So the first thing would be that a member would register with Nat, who is our admin lady. She's very, very friendly and approachable. She would then make sure that she points them to the right group for their particular condition and also get them registered so that they can see Dr. Rob, our GP. And their details will be passed on to the practitioners who would most likely contact them before they attended. And the actual groups themselves are very, very welcoming. All of our members are really friendly. We endeavour to create a safe, welcoming space, very much about diversity and inclusivity. So we do things that make sure that everybody is welcome, regardless of where they fit into society. So I would like to say that our groups are very welcoming, warm, safe spaces.
I think that's always sort of important for people to know, isn't it? Because there's that sort of reassurance that it's all going to be okay. You might have some worries because it's the first time that you're walking into a room or whatever.
Absolutely.
With people that you don't know, and you know, all of us can have that sort of feeling at times, can't we? So yeah, I think that's really helpful. Which just brings me on to Dr. Rob Gale, who anybody that may have listened or wants to dive back in and listen to the October podcast, where there's a whole strand of stuff around the Carers Awards 2023. Dr. Rob was highly commended. You'll hear him talk about on the podcast. He's of course involved, as you mentioned earlier, with Breathing Space. So I wondered if you'd say just a little bit about his role in things.
Sure. Dr. Rob works for Breathing Space 2 days a week, and he comes to all 7 of our COPD and chronic respiratory disease groups once a month. And the groups that he comes to, he delivers a range of teachings, really. He has an empowered patient program in which he aims to equip members with knowledge and resources to help them better manage their condition, answers questions, creates a platform for discussion, really, where they can learn from each other. and then also offers one-to-one appointments, which I know a lot of our members have found absolutely invaluable. They've been in positions where they haven't had a lot of input because of the system pressures, and Dr. Rob has expedited tests being done, results being obtained. So he certainly has a very positive impact on our groups.
I know that he did mention that it's just that opportunity to have a bit more time as well. Sometimes that is not always easy within the wider system.
And he is also a respiratory specialist, so he has that extra knowledge.
You mentioned at the beginning one of the sort of things that is part of the breathing space program is singing for lung health, and I just wondered if you'd tell me a little bit more about that.
Singing for Lung Health is a relatively new group. It began in 2022 and is a singing and harmonica support group for people with respiratory conditions. Although it's facilitated by us, it's actually run by a very talented musician named Chris Startup, and he creates a really fun, relaxing environment where members, without realizing it, are actually working on their breathing. When you sing and you make a sound, you are using air, you're using your exhale to make that sound. So you're essentially optimizing lung health through the practice and through having fun. And it's just a great, slightly different way, really, to optimize lung health.
And fun.
And fun, yes. I know the members have an amazing time, so I've been through to a few myself and sung along.
I think one of the great things often about being here in the office on a Friday is that you get to hear some of that.
Absolutely.
And there's a real energy that you pick up, which is fantastic.
Yeah.
And I know that support for people who are going through the experience of long COVID is something that is part of what Breathing Space offers, and you referred to the fact that, understandably, in a lot of ways, sort of people with long COVID might be very unwell, and so a lot of that may be online. Just wanted to ask you to sort of unpick a bit what the idea of that is. Is it peer support and other elements?
Much like the other groups, our intentions are to create a group and offer a group that's focused around peer support, but also well-being. So the long COVID group, we do allow extra time for the members to talk to each other and share their experiences because they find that particularly helpful. But I do also share a lot of well-being resources with them, which is part of my own training. So we do a lot of breathing practices, body scans, talking about diet and different ways to support them, really. We bring in outside speakers, as we do with all of our other groups as well, on topics that are relevant for them in particular. For the long COVID group, there isn't a massive amount of support out there for them. So I know for those members in particular, the group has really been, some of them have called it almost a lifeline.
Yeah.
It's been something really special for us to be a part of.
And I think as well that maybe, that as things have changed with the pandemic, it might be that for a lot of people, then the worst and most difficult days of the various lockdowns in 2020 are a kind of history in a sense, but COVID is still ongoing, isn't it? And
That's right. And long COVID is still significantly affecting a number of people. And unfortunately, in some sense, they probably would describe themselves as feeling a bit forgotten and unseen. And actually, they do need lots of support. So
I can see why it'd be a lifeline to get the support that Breathing Space offers. Just picking up on what we were talking about a short while ago, Keri, sort of helping somebody to maybe feel some sense of reassurance or feeling okay and reduce the sense of trepidation, maybe coming into a room, into a new group. What sorts of things can people expect to happen if they come to a Breathing Space group?
The first thing, obviously, is the access to Dr. Rob for the COPD groups anyway. And then because our approach is very much around well-being, We bring in a number of wellbeing resources, and that could be anything from breathing practices to body scans, guided meditations. We also bring in external instructors to do things like Tai Chi, seated and standing exercise, art and craft. We do a range of kind of holistic therapies as well when accessible. And all of this is very much tailored towards the members. So members with limited mobility are still able to sit in their chairs. Those who are able to stand can. It really is tailored towards the groups themselves as well and the members' conditions. As I was saying earlier, we also bring in guest speakers to talk on relevant topics, offer lunch. We've just brought out some healthier lunches now, which the members have been really enjoying. And then we also link in with external services. So, for example, in the past year, we've connected with Talking Therapies Northamptonshire and have started bringing them in to do talks, but also linking in with them in terms of a referral system, which has been really helpful for the members. Because as you can imagine, having a chronic condition, whether it's COPD or something like long COVID, can also affect a person's mental health.
And I think that's sometimes something that can be forgotten in a way, isn't it? Any health issue, I guess, that changes things for you and means that you might find some things that you can't do, or some things much more difficult, or increases levels of anxiety, then that's going to impact on your own mental well-being, isn't it, really?
It's all body, mind, it's all very interconnected, so you can't separate one from the other.
No, absolutely not. So if people are listening and think, oh, this is the first time I've heard about this, that sounds interesting, then how do they find out more?
The first thing would be to go onto the Northamptonshire Carers website and look for our What's On page. And we've got a list of our groups there. If they navigate to the Breathing Space group, there's an email address for our administrator, Natalie. There's a contact number if they prefer to talk to on the phone. And she'll be able to guide them to the right group, go through the registration process. We do require all members to register before they attend a group.
Yeah.
And this really is, as I said earlier, to ensure that they are pointed towards the correct group for them, but also because we need their medical details in order for them to see Dr. Rob.
I was just thinking that, so there's obviously yourself, and so how many other people are, if you're doing all of these groups and things? Sounds like lots going on. So how many?
Well, we have our project manager, Jazz.
Yeah.
I'm the senior wellbeing practitioner. And then we also have another 5 wellbeing practitioners. And between us, we run the groups all around the county.
I know that often things are always sort of have a level of fluidity or are evolving. So just wondered if there are any sort of future plans in the pipeline, Keri?
Definitely. Our service continues to expand, our groups are growing, and in order to ensure that we can continue to meet capacity and best support our members, as well as actually relieve some of the pressures on the wider system, because everybody knows the NHS is under a lot of pressure as well, we have some plans in place to pilot a new project, which will be with Public Health, GPA and Northamptonshire Sport. And this will be focusing on health inequalities in the N4 LAP areas, which are Dallington, Spencer, Castle, Abington and Phipsville, and I believe George and Kings Heath areas.
All in Northampton?
All in Northampton, kind of central, really. And the project will involve a kind of a hub and spoke model, where the hub initially will be based centrally, with the hub itself being open to wider patients. Mm-hmm. Eventually, the hub will divide into 2. There'll be one in the north, one in the west. And then the spoke aspect will be our breathing space groups. So members will initially, or it'll be patients coming from referrals via GP. Yep. They can actually self-refer. And they're also likely to be referred from Rocket and Restart, which are the pulmonary rehab teams at the hospitals. Yeah. They will come into the hub, which will be run by Dr. Rob, and it'll offer a 4-week program with a different topic each week. So the first week will be, what is COPD? How is it managed? Exacerbation management. Week 2 will be managing breathlessness. Week 3 will be managing mental health, anxiety, and things that are associated with breathlessness and COPD. And then week 4 will be the importance of activity in managing breathlessness. We likely will bring in some additional services in time, and those could be things like diagnostics, again, just looking to relieve some of the pressures on the wider system. But all of this is still in process and in the pipeline.
I'm sure that we can probably catch up at another point when some of those things may be kind of further down the line.
Welcome everyone, I am Keri. I'm going to be sharing a body sensing practice with you. This practice is best done in a fully supported position, either reclined in a chair with your head supported or lying on the ground. If this isn't possible and you are seated in a chair without head support, just allow the parts of your body that are supported to relax as much as possible. During body sensing, you are systematically moving your attention throughout different areas of your body. Practicing this regularly enables you to achieve deep physical and mental relaxation. It calms and soothes your central nervous system, and it stimulates your body's natural healing forces. Research shows that the long-term benefits of practices that involve body sensing produce a generalization effect. This means the deep relaxation you experience through a regular practice of body sensing can be extended to the rest of your daily life. The more you do body sensing practices, the quicker you can enter a state of relaxation. I'm going to introduce you to the practice first by inviting you to sense your hands. So with your eyes open, begin examining your hands. Look at your palms, your fingers. Look at the back of the hands and notice their shape, color, texture, lines, edges. Notice any hair, spots, and look at your fingernails. Noticing the thoughts that come into your mind as you examine your hands. Now close your eyes and feel your right hand. Let go of thinking about your hand. You're just experiencing the actual sensations that make up your right hand, that let you know that even though your eyes are closed, your hand is still there. Feel the sensations of pulsing, perhaps even throbbing or radiating. Just notice your hand as a field of sensation. Keep feeling your right hand. And now feel your left hand. Again, just experiencing the actual sensations that make up your left hand. Feel sensations of throbbing or pulsing, radiating. Just noticing your left hand as a field of sensation. Keep feeling your left hand. Now feel both of your hands simultaneously. Feel the sensations of pulsing and notice any other sensation that you may feel. Now open your eyes and keep feeling your hands. And then once again close them whilst continuing to feel your hands. Notice how as you feel your hands, your thinking about them decreases. And then notice how as you go into thinking about your hands, you go away from being able to feel them. This is because in reality, you can't feel your body and think about it at the same time. You can do one or you can do the other, but not both. This simple exercise is designed to reveal the powerful effect of feeling versus thinking. As you switch from thinking to feeling, thinking automatically slows down and you activate a natural healing response in your body. The longer you remain with body sensations, such as those of your hands, the more thinking slows down and the deeper the natural relaxation response will be, throughout your body and your mind. To begin the rest of the practice, assume a comfortable position, allowing your body to be fully supported by all of the surfaces that it is in contact with. If you are sitting in a chair, take a moment to inhale as you lengthen the crown of your head towards the ceiling. Now soften and relax your shoulders and allow your body to relax back into the chair, allowing your hands to rest in your lap. You can close your eyes, or you could just keep them downcast. Bring your awareness to your right hand thumb. Feel your right hand thumb. Right index finger, right middle finger, right ring finger, and right little finger. Feel the palm of the right hand, back of right hand, wrist, forearm, elbow, upper arm, right shoulder, armpit, right side, waist, hip, whole of right thigh, knee, back of knee, shin, calf, ankle, top of right foot, sole of right foot, right big toe, second toe, third toe, fourth toe, and fifth toe. Now feel the whole of the right side of your body all at the same time. Taking your awareness over to the left hand side, feel your left hand thumb, left index finger, left middle finger, left ring finger, and left little finger. Feel the palm of the left hand, back of hand, wrist, forearm, elbow, upper arm, shoulder, armpit, left side, waist, hip, whole of left thigh, knee, back of knee, shin, calf, ankle, top of left foot, sole of left foot, left big toe, second toe, third toe, fourth toe, and fifth toe. And now feel the whole of the left side of the body all at the same time. Taking your awareness to the top of your head, feel the whole of the top of your head. Feel your forehead, right temple, left temple, right eyebrow, left eyebrow, whole of right eye, whole of left eye, nose, right cheek, left cheek. Feel the whole of the mouth, right jaw, left jaw. Feel the whole of the jaw together. Feel the chin and feel the whole of the neck. And now feel the whole of the back of the body all at the same time. And then feel the whole of the front of the body all at the same time. whole of the right side of the body, whole of the left side of the body, and feel the whole body together, all at the same time. No parts are left out. Feeling the whole body all together at the same time. Now bring your awareness to the sounds that you can hear in the room, the sound of my voice, any other sounds that may be around you. And bring your awareness to the contact between your body and all of the surfaces that are supporting you. Remembering where you are in the room. Bringing some gentle movement to your fingers and your toes. You can start to wiggle them. Making circles with your wrists and your ankles. Taking a big inhale, lifting your arms overhead and stretching your feet in the opposite direction. And then very gently, slowly start to open your eyes and close them again. And then open them. Just taking a moment to look around the room that you're in. Again, bringing your awareness to the surfaces that are supporting you. And also feeling the sensations in your hands. And then once again, just taking a look around the room that you're in. Coming back to where you are. This completes our body sensing practice.
As ever, if you want to get in touch, that's always great to hear from you. You can contact us on 01933 677 907 and ask for Adam, Paul or Catherine. You can equally get in touch via email, podcast@northamptonshire-carers.org. And amazingly, that brings us to the end of another episode of the Northamptonshire Carers podcast. And it kind of feels appropriate given that the clocks have changed and it feels dark in the mornings, it feels dark in the evenings, to end with lyrics of Bob Dylan. It's not dark yet, but it's getting there. Goodbye.
This podcast is created by Northamptonshire Carers and is a Man with a Beard production.